Before seeing the hospitals, I did imagine it to be slightly chaotic, a bit more disorganised than the NHS, because it is a developing country and they do have less resources than we do at the moment.
One of the reasons why I started MAA is because I was in the hospital, and I don't know if you heard the story, but I saw a mother bleed to death and a newborn baby sadly pass away, and the hospital that happened was in this one.
So initially we were all very shocked. To set the scene, we went into the maternity ward and it was a very small cramped room filled with around 8 to 10 women. All these women were in various stages of pregnancy. Some had given birth and some were still pregnant.
The first thing we saw was a woman literally on the sidelines screaming out in pain, and I was shocked, but nobody was batting an eyelid.
But being there in person and seeing these people is completely different. They're not just another number, they're not just another statistic, they're not just another fact, or they're none of that. They're real human beings, and obviously it may sound obvious, but when you're there and you see that every single person you meet, every single person you speak to or see or help, all of them have their own stories, their own personalities.
I saw there was a severe lack of beds, severe lack of medications and resources for these mothers. I especially remember seeing a mother breastfeeding on a staircase and another mother nursing her child next to a pillar.
So we spoke to one woman in particular. She had just given birth. She was on the floor because there were no beds. And when you ask these questions, you get to know that actually this woman was her first baby, and she had feeding issues. And it turns out that actually she was producing enough milk, but she thought it wasn't enough. And so she ended up overfeeding her baby with watered down formula.
In Bangladesh, formula milk is quite expensive, so what the mother did was she diluted it so much to the point where it was basically water. And this baby was constantly vomiting and vomiting. And she couldn't do anything about it because she simply had no energy and she simply had no strength to even look after her child. And when I looked around, I saw that everyone looked very, very miserable. And for them, childbirth wasn't anything they were looking forward to. Their main issue was, how am I going to sustain this child? How am I going to help them to survive? How am I going to bring them up in this economy?
So the main work we do in MAA is to provide antenatal checks to women in the camps, the healthcare camps. And what these checks are, they're very simple checks. They're blood pressure checks, the blood sugar checks, and we check the urine. And these things can honestly just prevent major obstetric emergencies. I personally didn't realise how important this was before going to JourneyMaa, but going in and seeing the work we do and what it's prevented and how many women it's helped, you realise that the work we do is really important and that we need to keep on trying.
When I was at the MAA health camps, it provided that primary source of care for those mothers who have never seen a doctor before during their pregnancy. MAA gave them a chance to have some basic investigations done.
With a lot of these people in Bangladesh, especially in the villages that we were at, they don't have access to this kind of stuff. They can't, they can't call up a GP and have that conversation. They can't go to A&E and have those investigations done. They can't have any of that. So that's why MAA is so important and critical. It's there to provide this healthcare for people that are disadvantaged and don't have access to it. And it's so important. And I saw how important that is.
I think one of the most important things is the education part, because once we help one mother and we sort of educate her, she can then spread the news to other mothers, and she can spread the news to her own daughters as well. And I think that's really, really key, because we're sort of supporting these mothers for life.